This is a very dynamic situation, and changes are constantly occurring. As we gather more information, we will share it to you. Swine flu has been identified in 7 different countries, including the United States, and as of just the last 30 minutes, the CDC has informed us that there are 91 cases of swine flu that have been confirmed across the United States. And of those 91 cases, 16 of those confirmed cases, are from the state of Texas. We expect that as this outbreak continues, we will find more hospitalized patients, and as Dr. Besser has said, we expect that there will probably be some additional deaths in the United States, and we need to continue to watch that closely. The CDC and the World Health Organization have not yet called this a pandemic. For us in the state of Texas, we have to be cautious and have to prepare for a pandemic so that we have the things in place so that if this continues to increase, that we're ready. The World Health Organization increased their level to level 4, which is an alert phase for a pandemic. And again, in light of the incomplete picture, without all the data, we believe it is prudent for us to operate in this heightened state of awareness. We have a lot of experience with disaster preparedness here in the state of Texas, especially with hurricanes. And with hurricanes, we've learned that it's very important for us to prepare for a higher level of hurricane than what we were expecting. That is prudent. That allows us to be prepared and allows us to respond appropriately. And so in the current climate, we are doing the same, and we've activated our pandemic flu plan so that we are prepared and can protect the individuals that are throughout the state. We have developed specific information for Texans using CDC guidance, and we've provided that to our local health departments, our healthcare providers, hospitals throughout the state, nursing homes, first responders, so they have the detailed information they need in order to make critical decisions here in the state of Texas. And this information is being sent out through our public health information network, through healthcare provider associations, and through our website. We have a website that's dedicated to this, to swine flu, at www.dshs.state.tx.us/swine flu. We've asked individuals to stay home. This is a very important message. If you're sick, now's not the time to come to work or time to go to school. It's very important that you stay home. And we're giving guidance on the appropriate use of these antiviral medications. As Governor Perry discussed earlier, we have purchased antivirals for the state of Texas over the last several years, and appreciate the legislature support and the governor's support in the purchasing of those antivirals. And we've asked the CDC to bring in 25% of our allotment of the strategic national stockpile. In schools where we have swine flu, we have recommended that schools be closed. We're urging individuals across the state to follow good hygiene precautions, the kind of precautions we use to decrease the spread of any type of respiratory illness. I've said it before, and everyone's repeating it, but it really is important if you're sick to stay home. If you're coughing or sneezing, you need to cover it. And if you cough into a tissue, you need to throw it away. It's very important that we wash our hands and do it frequently, and if there's not soap and water, to use the alcohol gels. Finally, I want to emphasize this again is a very fluid situation, and as we learn more about this situation, we will rapidly share that information. This is a serious public health threat, but we believe our approach here in Texas is prudent. It's not panic. We believe that the information sharing will allow individuals and the communities to take the appropriate steps they need to take in order to protect themselves and their community.